Type 1 and Type 2 Diabetes by Emily Bach. Diabetes. Diabetes is a group of disorders that affects the body's ability to use glucose. Diabetes leads to an insulin deficit. Insulin is a hormone produced by the body that regulates metabolic processes. With insulin deficits, the body either produces less insulin or no insulin, or the body becomes resistant to insulin, or a combination of the two can occur. Insulin deficits lead to abnormal carbohydrate, protein, and fat metabolism. This leads to impairment in the transport of glucose and amino acids to the cells. Although there are several types of diabetes, in this presentation I'll be discussing Type 1 and Type 2 diabetes. Type 1 diabetes is the more severe form and requires insulin. Type 1 diabetes is an autoimmune disorder where the body destroys the pancreas's beta cells. As a result, the body is no longer able to produce insulin and requires replacement therapy. Type 2 diabetes. Type 2 diabetes is often regarded to be the more milder form of diabetes because people aren't necessarily insulin dependent. Also, type 2 diabetes can often be prevented or managed through dietary changes and increased exercise. Type 2 diabetes results in insulin resistance or an insulin deficit. The insulin deficit can be caused by decreased insulin production by the pancreas's beta cells, or an insulin resistance can result because the body cells become more resistant to insulin, making the insulin that's produced by the beta cells less effective, or the liver can produce increased levels of glucose, or a variety of factors can result that cause type 2 diabetes. The pathophysiology behind type 1 and type 2 diabetes in the initial stages. The insulin deficit leads to less insulin to the cells or less use of insulin by the cells. This leads to hyperglycemia or increased glucose levels in the blood. The excessive levels of glucose in the blood lead to spillage of glucose into the urine. Glycosuria is regarded as glucose in the urine, which is abnormal. There's glucose in the urine because the increased glucose overwhelms the renal tubular and it fails to reabsorb all the glucose in the urine. The glycosuria then leads to polyuria or excessive urine excretion. This is because the glucose in the urine leads to osmotic pressure changes that lead to excretion in large volumes of urine. The polyuria causes the body to lose excessive amounts of fluid and electrolytes from tissues. The body attempts to compensate for the losses by drawing water from the cells. This eventually causes the body to become dehydrated. The dehydration triggers thirst, and the body attempts to compensate by drinking excessive amounts of water, known as polydipsia. Polyphagia also develops because the cells lack nutrients. The body triggers appetite to attempt to get more nutrients. The pathophysiology of type 1 and type 2 diabetes continued. The progressive effects. If the insulin deficit continues after the initial stages, then additional consequences result, eventually leading to diabetic ketoacidosis, or DKA. The lack of glucose in cells leads to catabolism, or the breakdown of complex molecules to simpler molecules for energy. In this case, the body breaks down fat and proteins, leading to ketones in the blood. Ketones are the byproducts of fatty acids. The body can only process a limited amount of ketones at once. Eventually, ketoacidosis develops. Ketoacidosis is excessive levels of ketones in the blood. The body attempts to compensate for the ketoacidosis by excreting ketones in the urine, known as ketouria. Eventually, the body becomes dehydrated and decompensated metabolic acidosis results, otherwise known as DKA or diabetic coma. The risk factors for both type 1 and type 2 diabetes involve race, genetic, and environmental factors. As previously discussed, type 1 diabetes is an autoimmune disorder. There are several risk factors associated with type 1 diabetes, including being white, living in a cold climate, and genetic factors, including having a family history of type 1 diabetes. Scientists also believe that type 1 diabetes has something to do with viruses, being infected with certain viruses, but they're unsure which viruses exactly. Risk factors for type 2 diabetes include being overweight or obese with having a high level of abdominal fat distribution, advanced age, including 45 years and older, having a sedentary lifestyle or frequently inactive lifestyle. Race is also a risk factor for type 2 diabetes, with more African Americans, Hispanics, Native Americans, Asians, and Pacific Islanders having higher rates of type 2 diabetes than whites. A family history of type 2 diabetes, also having gestational diabetes, polycystic ovarian syndrome, hypertension, and hyperlipidemia increase your risk for type 2 diabetes. 3 diabetic complications include hypoglycemia, neuropathy, and infections. Hypoglycemia is caused by excessive insulin and decreased glucose in the blood. The blood sugar drops below 70. It's caused by strenuous exercise, medication errors when there's too much insulin given, or inadequate carb intake, which can happen from decreased diet, dietary intake of carbs, or even vomiting. This can be prevented by not skipping meals, properly taking medications, and frequent blood sugar checks. Neuropathy is the impaired sensation, numbness, tingling, weakness, or muscle wasting that occurs. It's caused by nerve damage that results from hyperglycemia. There are degenerative changes that occur to nerves that result from ischemia or altered metabolic processes. This can be prevented by managing blood sugars, managing blood pressure, and cholesterol. Infections are caused by vascular impairment, where there's reduced blood flow to extremities, or also elevated blood sugar levels. Also, delayed healing occurs because of the changes that occur to diabetics' vascular systems. These can be prevented through adequate blood sugar control, taking medications as prescribed, frequent hand washing, receiving the flu vaccine and other recommended vaccines, and taking proper care of your feet. HbA1c, or hemoglobin A1c, stands for glycosylated hemoglobin. It monitors long-term blood sugar control over 8 to 12 weeks. The blood sugar enters the body and attaches to hemoglobin. So higher blood sugar levels increase the hemoglobin A1c levels. This is important for diabetes management because it shows on a longer term blood sugar control. So it gives a better picture of how their blood sugars have been over a longer period of time. Their goal is to have an A1C of less than 7%. Diabetes medications. 2 diabetic medications include metformin and insulin replacement. Metformin is used for type 2 diabetes. It decreases insulin resistance and reduces glucose production, which therefore reduces blood sugar levels in the blood. Insulin replacement is for both type 1 diabetes primarily, and then also type 2 diabetes in severe cases. It's a biosynthetic form. There's 3 different types of onsets, including rapid onset and short acting, intermediate acting, and slow onset and long acting. These insulins replace the insulin in the body, and they help reduce blood sugar levels. The following slide contains my references. Thank you for watching my presentation, and I hope you enjoyed it and you learned something.